to go over silicon nitride again, highly osteoconductive. It limits bacterial growth and adhesion. It's clear radiographically, so it's easy to see bone growth through it or around it, which can be a limit around some of the metal implants that we have for lumbar cages or different types of implants. So focusing on medical, because this is a more of a medical talk, we see opportunities in implants all throughout the body. We're focusing early on foot and ankle, and I'll explain why in a minute, but it's not limited to really any part of the body. We've identified more than 100 different implants to date, and we go through a process of validating the can we make it, should we make it, and let's go make it type of philosophy. So can we do it in a way that's going to improve people's lives? Are we going to be able to sell it? Are we going to be able to make money on it to where we can reproduce it and value it? And are we actually making a difference? So it kind of goes back to the old example in medicine. You don't change a technique unless you can prove that the new technique is actually better. And that takes a little bit of time and testing. We certainly don't want to spend a whole bunch of energy making something that's just as good as what's on the market.